So I'm Bobby Gaspar. I'm a paediatric immunologist from Great Ormond Street Hospital and University College London. So I'm a practicing paediatric immunologist at Great Ormond Street, where we see children with primary immunodeficiencies and severe combined immunodeficiency. And for a long time we've been trying to improve the outcomes of children with SCID. And one of the most important things in treating children with SCID is being able to make the diagnosis early. And so we believe that newborn screening for SCID has a huge importance in improving the outcome of the lives of these children. And what we want to do is to be able to implement newborn screening for SCID in the UK. And that's what we're trying to achieve. SCID is a very rare disease. These children are born essentially without any functional immune system, and so are vulnerable to all kinds of infections in the first 6 months or so of life. We know that if we don't treat these children, they will essentially die. Even now that treatments are available, we still lose children because they haven't been diagnosed, and also some children come into treatments in a very poor state, and we lose them through that procedure. So there is a really poor outcome for this disease even now. Even though these are rare conditions, these children are there's a great burden to the health service as a result of looking after children with such severe infections, and of course a great burden to the family who have to go through the treatment of these children, and also the fact that they may actually lose children. So there is a great impact not only to the health service but also to the families who are affected by this disease. So the current treatments are, once a child is diagnosed, firstly to protect them from infection. So we can do this by giving prophylactic antibiotics, or we can give antibody replacement therapy. Now those are not curative measures, they just stabilize the child and prevent further infections from happening. The only way that we can really cure the disease is by replacing the immune system. The standard treatment for doing that is bone marrow transplantation, where bone marrow from a matched donor is given to the child, and there are also now newer therapies such as gene therapy, which relies on knowing the gene defect in the baby's SCID and actually inserting a working copy of the gene into their own bone marrow. So bone marrow transplantation and gene therapy are the treatment options that are available. So we've been working with the UK Screening Committee now for approximately 6 years to make them aware of the diagnostic possibilities that are available, the fact that there is a screening test for SCID, the fact that that screening test is now being used almost uniformly in the USA and other parts of the world. We've been giving them evidence that using a screening tool can identify babies at birth, can protect them from infection, and give them a much better outcome. So that evidence has been looked at, there have been a number of reviews, and the latest review process was undertaken in June this year. And the committee has decided to implement an evaluation study in the UK. Now that means this is a study that will take place in certain regions of the UK and will prospectively screen babies, and through that will identify babies with SCID, and also address certain issues that the committee are currently uncertain of. And hopefully, if these issues are addressed satisfactorily, we'll be able to move to a full national programme for SCID. I think that's still to be decided, and really we are soon going to have some workshops to try and work out exactly what this evaluation study will look like, how many babies will be screened per year, how long the evaluation study will run for, what the parameters are before we move to a national programme. So at the moment it's not clear exactly how long the evaluation study will run for, but hopefully we'll have some more information very soon. Only to say that I think this is a really important issue. This is a huge, an important way of identifying babies at birth. We know that this will lead to better outcomes. If we can screen babies at birth, we can protect them, and then they can go into transplant or gene therapy in a good state, then we'll get over 90% survival outcome. and that will make a huge difference to the lives of these babies and also their families.